Hi, I'm Twila-Faye Burgmann. I'm a physician. I'm a gastroenterologist at Royal Inland Hospital. People who have family histories of colon cancer in their family or any gastroenterological illness such as inflammatory bowel disease are at greater risk. If you have a family history of colon cancer in your family and it's a first-degree relative, meaning it's your mom, dad, brother, sister, someone who's close to you, then you should be getting a colonoscopy every 5 years or sooner depending on what your doctor has told you. It's actually the second leading cause of death for men and the third leading cause of death for women. So when we look at the statistics of how much we use our equipment at Royal Inland Hospital, we run it to the max. Like, we put hours on these scopes and get our full mileage out of our equipment before we ever retire them. We have 3 of these now and we're actually very excited. We've just opened up the 3rd room. Unfortunately, we're only funded for 2 days a week and the demand of the community could really use all 5 days. But we're excited that we have the 3rd room open and running with enough equipment, thanks to some private donations, to actually make it run. I'd like donors to know that their contributions are very much appreciated, first off. They're not taken for granted, because sometimes they can be targeted to certain technologies, especially newer technologies that we would never otherwise get. And that can make a big impact on patient care when we may not otherwise be funded. Special things in my own field would be things such as the FibroScan machine, which we would like to get, or the endoscopic ultrasound machine, which we would love to get. And we have the training to do those things, at least in the endoscopic ultrasound, and we'd be more than willing to get training for the others, but it can really make a big difference in patient care. The other thing that corporate donors need to know is that we rely on their funding. It's not just buying the extras, it's also standard of care and standard equipment we need that needs to be replaced. We would not be the hospital we are today without the private donations coming in.